Good morning, listener. You are tuned to Breakfast Show on Coal City 929 FM, Radio Nigeria, Enugu. The program where we spark conversations that inspire action and build a healthier nation. November 19, 2025 is World Toilet Day, a day the world comes together to talk about something many find uncomfortable, yet it affects our dignity, our health, our children's future, and our environment. Sanitation and the fight against open defecation. The country has made progress, but millions still lack access to safe toilets. Open defecation remains a challenge in many communities, posing risks like disease outbreaks, water contamination, insecurity, especially for women, and lost productivity. It is not just a health priority, it is a national development and human dignity mission. To help us unpack this issue, we are joined by two passionate advocates working at the front lines of sanitation and hygiene rights. Mr. Kingsley Urama, Communication Officer at Network of Water Rights Initiative, NEWARI, a leading voice pushing for water justice, sanitation rights, and community empowerment across Nigeria. Also joining us is Comrade Uche-udo Ezeaku, Open Defecation Free Hygiene Advocate and Acting President of Women Support Women Community Network, WOSCONET, championing dignity, safety and sanitation access, especially for women and vulnerable groups. Ladies and gentlemen, welcome to the show.
Thank you.
Thank you very much.
Mr. Urama, let me begin with you. When we talk about ending open defecation, it goes beyond building toilets. It's about human rights, public health, behavioral change, and infrastructure. For the benefit of our listener, can you paint a clear picture what exactly is open defecation? Why does it persist in communities, and how does it affect health, safety, and national development?
All right, thank you for the question, and permit me to use this time out to thank you for this opportunity given to Network for Water Rights Initiative to add our voice to end open defecation in Nigeria today. Simply put, open defecation is the practice of defecating or the disposal of human excretors in the fields, bushes, water bodies, and other open spaces. This exposes these fecal materials in ways that it can easily come in contact with other people and animals. This is a pattern fecal pathogen and infections spread. Access to clean water and sanitation is a fundamental human right, and indulging in open defecation threatens this right, posing danger to public health and safety. Infections in our societies today emerge and re-emerge on a daily, frequently causing endemic and epidemic situations. And this stresses our healthcare system. It affects movement, it affects businesses, and it's a stress on national development. So trust me, we really need behavioral change in the sense that we need to understand that the practice and use of a clean toilet is better and is a better option to open defecation. Thank you very much.
Thank you. Now, Comrade Patience, sanitation is not just a hygiene issue. It is a dignity and safety issue, especially for women and girls. Many face harassment, exposure to disease, and even gender-based violence when forced to relieve themselves in open spaces. From your advocacy work, how does open defecation uniquely impact women and girls, and why must we prioritize gender in sanitation campaigns?
Okay, thank you very much. Yes, prioritizing gender in sanitation campaigns is essential because men, women, girls, and other gender groups experience sanitation challenges differently, and ignoring those differences can lead to unsafe, ineffective, or unequal outcomes Here are some main reasons why gender must be a priority. Number one, we talk about women and girls who have specific sanitation needs. Women require privacy, safety, and facilities for menstrual hygiene management, such as clean water, disposable bins, and safe spaces for changing. Knowing that lack of proper sanitation often leads to health issues, missed school or work days, and discomfort during menstruations. So, it is obvious that it must be a priority for each and every one of us. Open defecation uniquely and disproportionately affects women and girls because of biological, social, and cultural factors that make their sanitation needs and vulnerabilities different from men's own. Number one is loss of privacy and dignity. Women and girls need privacy when defecating or managing menstruation, but open defecation forces them to go into open or exposed areas, often at dawn or dusk, to avoid being seen. This lack of privacy causes shame, embarrassment, and psychological distress and undermines their dignity. Thank you as we move on.
Okay. Nigeria launched the National Clean Nigeria Use the Toilet campaign to make the country open defecation free. But progress requires sustained investment, community ownership, and political will. Mr. Urama, where are we today in terms of progress, and what roles should government, local councils, and development organizations play to accelerate Nigeria's open defecation-free ODF target?
The aim and target of Clean Nigeria campaign is to making Nigeria an ODF country by the end of 2025, though this has now been extended to 2030. Currently, Jigawa State is the first and only state in Nigeria to have attained ODF status way back in October 2022. And up to date, no other state has achieved a complete statewide ODF status. Though quite alright, some states like Katsina, Kano State, Benue State, and many other states are putting in visible efforts to achieve this status. Out of the 774 local governments in Nigeria, 672 are yet to be certified or validated to ODF status. Down to our dear state, Enugu State, thanks to the visible efforts of UNICEF, input from the State Ministry of Water Resources, civil society organizations, the WOSCONET departments of Igbo-Etiti local government. Igbo-Etiti is the only validated ODF local government in Enugu State. Quite alright, it is the duty of the government to provide leadership and basic amenities, and such amenities as a clean water and sanitation to the people of the state. On this, we encourage the state government to extend its water campaign to the rural areas, just like they have done to Agbameri community in Nsukka local government area of Enugu State. The role of community stakeholders are indeed very much needed in getting the citizens involved in this campaign and helping to domesticate this idea of ending open defecation as their own and seeing the benefits it brings to our individual and communal health.
Many communities have toilets but still struggle with adoption. It tells us infrastructure alone is not enough. Changing norms and habits is equally crucial. Comrade Patience, what behavioral change strategies have proven effective in communities, particularly with women and grassroots groups, and how can local leaders inspire change?
Okay, thank you very much. Many communities have toilets but still struggle with adoption. It tells us infrastructure alone is not enough. Changing norms and habits is equally crucial. So, to make this a sustainable thing, we are looking at so many strategies which we can apply or implement to make sure that open defecation is sustainable. Grassroots participation in the sensitization is another step towards ending and sustaining ending open defecation in our communities. Groups and local leaders can also inspire change by developing a community implementation plan, which is called the CHIP. Most communities have gotten their CHIP to enable them sustain ending open defecation and promote hygiene in their communities. And some of these CHIPs, we have in them environmental sanitation, continuous sensitization, engagement, and a lot of the communities were able to set up a task force team and sometimes a WASH team that will be able to move on. We call them hygiene promoters, to continue promoting hygiene in their communities, in schools, in churches, in their women gatherings, in their social clubs, at every point in time, to ensure that people make it a daily thing, a daily part of their living on daily basis. So we encourage each communities, each social group to encourage and adopt their community CHIP and make good use of it. Some of them decided that every end of the month, the last Saturday of the month, they will be doing market sensitization and environmental sanitation, depending on when it falls in. So if the community makes it a priority to do a community sanitation, it also encourages them to remind themselves of hygiene promotion and the need for sustainability, knowing that the impact can never be overemphasized.
Okay, if you're joining us on the breakfast show called City 929 FM, Radio Nigeria, Enugu, we are talking about World Toilet Day 2025. Topic, Ending Open Defecation, with guests Kingsley Urama and Comrade Patience Uche-udo Ezeaku. Now, we cannot talk about sanitation without water. No water means poor hygiene, dirty facilities, and reluctance to use toilets. Mr. Urama, how critical is access to clean water in achieving open defecation, free communities, and what should be prioritized in rural and urban slum areas?
Yes, access to clean water and sanitation is one of the United Nations Sustainable Development Goals out of the 17 goals of the United Nations. Achieving this particular goal is key to achieving the other SDGs. No access, limited access, high cost to access, and use of dirty water is at the center of the healthcare challenges we have in our societies today. Practicing open defecation predisposes these individuals to fecal-oral transmitted infections, toilet-acquired infections, which takes a serious toll on our society today, health-wise, and most importantly, on the female population. We cannot, it is very difficult to have a clean toilet if water supply is not available, affordable, and accessible. The government of Enugu State has promised water supply to the good people of Enugu State. We are actually seeing the good work they are doing, what they have done, and what they are doing in the water sector. It is quite commendable. But I would like to bring to their notice that most of the water galleries we have in our state today are no more functioning, and most of them never worked. And I encourage the authorities to deliver more on the state water reticulation project. In the rural areas, the state government should collaborate with the local government authorities to rehabilitate government-owned water supply, water infrastructures, which are mostly not functional at the moment. Citizens have a right to play, and they should also support the effort of the government to making these things come true and contributing their own little quota to getting this our ODF status.
Ending open defecation is a collective journey. Households, schools, civil society, private sector, and traditional institutions must all be involved. Comrade Patience, how can grassroots women's groups like WOSCONET help mobilize communities, and what partnerships are vital to sustaining open defecation-free ODF achievements?
So far, WOSCONET has helped in communities, like the recently concluded program in Igbetiti. WOSCONET was able to cover 42 communities in Akko Ward, and the result was very impressive. We did a lot of community sensitization, mobilization, and all that. But in sustaining it, it is still the duty of the communities, the stakeholders, the women leaders, the community WOSCONET chairman, the ward councillors, the rural fathers that are supposed to come together and create a bylaw which was developed during the sensitization program, the CHIP, that is the Community Hygiene Implementation Plan, and run with it. That is only way for sustainability. Knowing that it is now serving as a community bylaw, so any defaulters were given some level of bills or so, or punishment for defaulters. So if it is a sustainable thing for them, definitely they will end open defecation. Other donor agencies like WaterAid and UNICEF has been doing a whole lot to sustain end open defecation in our communities. So we should also continue with them and seek further partnership with other agencies. Like the Rural Red Foundation has also been doing a lot. They've been doing a whole lot. Like as I'm speaking with you right now, they are in Akko, building toilet facilities and recycling centers for waste collection and management. So a lot of other donor agencies are there to support and encourage the end for open defecation.
As we round off, I would like each of you to give us a closing message. Mr. Urama, what is your one message to government leaders and policymakers this World Toilet Day?
Honestly, I call on all well-meaning Nigerians to contribute their little quota any way possible to achieving this ODF status. It is to the best benefit of our health, so let's domesticate its practice. I also call on the government authorities, also pray to them to work on the already existing policies we have in our states. For instance, in Enugu State, we have the Enugu State Water Law. This will ensure adequate water supply to support and encourage the behavioral changes and attitude towards the development and use of clean toilet infrastructure. Finally, in line with this year's World Toilets Day theme, I would say we will always need toilets. So please, let's develop it now. Thank you so much.
All right, Comrade Patience, your one message to families, mothers, and community champions listening this morning on World Toilet Day.
Yes, in summary, I would say open defecation magnifies existing gender inequalities. It compromises women's safety, health education, and dignity, and perpetuates the cycle of poverty and exclusion. Addressing open defecation with a gender-sensitive approach is crucial for achieving health equality and gender justice. Gender-sensitive sanitation campaigns ensures that facilities are safe, accessible, and equitable for everyone, improving public health, protecting dignity, promoting gender equality. Thank you.
Okay. Thank you, Mr. Kingsley Urama, Communication Officer, Network of Water Rights Initiative, NEWARI. Comrade Patience Uche-udo Ezeaku, Open Defecation Free Hygiene Advocate, Acting President, Women Support Women Community Network, WOSCONET, for the incredible work you do and for joining us this morning. Nigeria can and must achieve open defecation free status. It starts with one home, one school, one community at a time. A safe toilet is not a privilege, it is a right. Okay, stay tuned, stay informed, and remember, a cleaner nation begins with you. Use the toilet, keep your environment clean, and protect the dignity of every citizen. Happy World Toilet Day. All right, that's it on Breakfast Show, Coal City 929 FM, Radio Nigeria. Producers have been Jude Obu and Anayo Egere. Supervisor Kate Nebo, General Manager, Coal City FM, Enugu. Executive Producer, Zonu Director, Radio Nigeria, Enugu National Station, Dr. Uche-udo Eze. I am your presenter, Ngozi Ebo. Thank you for listening.